Hi, everyone. I'm Dr. Daniel Careaga. Today, I would like to talk about sleeping, specifically sleeping after a tummy tuck. This is one of the most frequent questions I get asked by my patients. So, people sleep usually one of three different ways. People are either back sleepers, side sleepers, or stomach sleepers. So, what do I do in a tummy tuck that makes patients want to know how they can sleep? Well, the operating table, as you can imagine, is flat. Once the surgery is performed, and once I'm about to remove the extra skin, we actually take that operating table and we fold it to about 35, 40 degrees to be able to remove as much skin as possible. So, as you can imagine, the patient's not going to be able to stand up straight or lay flat for usually on average about 10 to 14 days after the surgery. So, back sleeping is not really a possibility. Stomach sleeping is absolutely out of the question. You cannot try to force sleeping on your stomach because you can actually tear things, the things can come undone, but you'll know because it would be painful. So, what is the best way to sleep after a tummy tuck? Well, there's several options. So, one is if you have a recliner at home, that actually makes life a lot easier. If you don't have a recliner, you don't need to go and get one. I generally recommend sleeping with 3 or 4 pillows behind your back, 2 or 3 pillows under your knees, and that will keep you in a what we call semi-flexed position that keeps the tension off of the incision and the abdomen, which is very important. I generally recommend sleeping that way for the first 7 to 10 days. Afterwards, I recommend sleeping essentially in any position that you can get comfortable in, which could be the same position, it could be a slightly flatter version, or also sleeping on the side. So side sleeping is also a good position because it doesn't apply any tension on the incision or on the abdominal skin. So sleeping obviously is very important after surgery, and being comfortable is very important. The important thing to remember is this: before damage anything, before causing any damage to the surgery, there will be pain associated with it. So listen to your body. If you are in a position where you feel tension building, where you feel things tightening, and if you feel pulling or pain, stop that position. We want to generally maintain the incision and the abdominal skin free of tension while it's healing. This minimizes the risk of complications and it also promotes good scar healing. So here's a fun fact about sleeping. So about 10% of the population are stomach sleepers, about 20% are back sleepers, and about 70% are side sleepers. So back sleepers have it very easy during a tummy tuck. All they have to do is sleep with a few pillows behind their back and a few pillows under their knees, and they'll be perfectly comfortable. Side sleepers, I generally recommend sleeping in that same position, the semi-flexed position, with a few pillows behind the back and under the knees to take tension off of the skin and the incision. And stomach sleepers are the ones that I really take extra time because even once the tummy tuck has healed in the first few weeks, you don't want tension on your incision, on your scar as it's healing. Imagine that tension is the enemy of scars. The more tension that there is on a scar, the higher the likelihood that it's going to develop into a thicker, raised, darker scar. We want the tension to be completely off of the skin edges while it's healing. In the early period, because we don't want a complication. Now, what type of complication? Well, a stitch could tear. There could be fat necrosis, meaning that some of the fat underneath the skin that is surrounding the suture can die because of the tension. It can leave some firm knots behind the incision. So we really want to avoid any local wound complications due to excess tension. So that would be in the first month after the surgery. And then after that, as the scar is maturing, we don't want tension on it because we want it to heal well. We want the scar to heal as a thin, normal skin colored, fine line that is soft to the touch and essentially imperceptible.